So gene expression profiling has been utilized to do a molecular classification of myeloma, identifying patients that present clinically in a certain way and behave clinically in a certain way. On top of that, there have been efforts to utilize gene expression profiling to identify patients at high risk of relapse. So this is a prognostic tool, that has been developed in the context of uniformly treated patient population. So the Arkansas group has done it. Professor Sonneveld has done so through EMN. So there are a few platforms, tested and validated platforms that are available, and they're available in the U.S. as well as in Europe. And gene expression profiling can identify, a broader group of patients at a high risk of relapse, again, in the context of therapies that those, patients, subgroups have received. I think, in the grand scheme of things, gene expression profiling, is kind of becoming a legacy kind of technology, and becoming cheaper. So I think it can become a very important tool in how we identify high-risk patients, in the general myeloma population when they're diagnosed. And yes, you can have overlays of mutational analyses on top of that, but I think GEP can play a very important part. And the previous issues used to be cost, but because it's becoming an older technology, I think the cost has gone down significantly. So this is something that can be incorporated into clinical practice. It's certainly something that we are trying to explore in some of the clinical trials.